All right, good afternoon. I'm here today with Dr. Tom Davis. Uh, Tom is a physician. He's involved in value-based care, and we're going to talk about what value-based care means to him and how patient engagement impacts value-based care. Good afternoon, Tom. How are you?
Good afternoon, Ray. How are you?
I'm doing well. Doing well. A lot of people talk about value-based care as if they know what they're talking about and what it is. I wanted to get your opinion about what value-based care is to you and to physicians and how they can be impacted by value-based care and how they can take advantage of it.
Well, Ray, this has been something that has been under discussion for decades. What is value in healthcare? And the government, who is the final indemnifier of healthcare in our nation today, has decided that value is what's left over after you have provided care to a given beneficiary under a fixed budget. So your net performance is what is defined as value. Now, there is a journey to get to that model, but at the end of the road, that's what that model is. How much is left over after you've cared for a given beneficiary under a budget? And the challenge with value-based care is to collect the data that you need to make sure that that budget is accurate and reflects the actual disease burden and risk associated with a given beneficiary. So value-based care, as we're talking about today, is a data-driven payment model, and the outcome is defined by the balance of your performance. Because once that patient identifies you as their doctor, they're going to allow you to curate their care costs. And so now you got them on both sides. You got them on the revenue side, and then you got them on the cost side. And for those folks that are beyond the edge of the map that really have never engaged with you, that journey begins with a tool like Precision is offering. And I have seen it all, Ray. I have engaged with any number of folks that try to do this, and Precision is the only one that integrates it in a spectrum of paths, and is the only one that really does it with really a revenue positive way, with no upfront costs and no additional infrastructure on behalf of the provider.
So thank you, Tom. You know, the key points that I hear from you right today is the idea that you want to manage costs, you want to generate revenue, you want to be able to first and foremost take care of your patients, and you want to know who all your patients are. You know, providers don't necessarily always see every patient that's on their roster. They may end up seeing 30 to 40% of their patients. They may only see certain plans that are engaged with the patients on behalf of their providers. So it's an interesting approach. Again, value-based care has been a question mark. People don't know exactly what it is, how to deal with it, and I think that you've put put out some interesting clarifications and provided some clarity on how to approach it. So thank you.
You're welcome. It's important to understand, all you providers out there that are listening to this, the government has a heart. It understands that there is an expense associated with pivoting from value-based care, from fee-for-service to value-based care. So there are any number of different revenue opportunities, short-term revenue opportunities, to help you fund that pivot. The challenge is, of course, investing in your own resources in order to capture those revenue streams. Precision's model is something that you will never see anywhere else, and it allows you to capture at least one set of those streams without any additional out-of-pocket costs in your hand. And I strongly urge anyone who's either making the pivot or looking to enhance their value-based care performance to sit down with Ray, take a look at it. You will be very impressed.